and soul and humor and inclusive and non-judgmental, non-academic, non-condescending, non-paternalistic, to me, is the responsibility that we take with us when we ask for somebody's engagement.
Any recommendations on how we can make that engagement more successful?
Is that for me?
Yes, please.
I think we often forget to apply the smell test. We do a lot of having two personalities, the personality that we bring to work as we lecture what people should do to be healthy and to take good care of themselves, and then the personality we have at home when we have our third glass of wine and don't get 7 hours of sleep and don't go get our preventive screenings. So I think first and foremost, just start with how are you doing and what would you pay attention to and what websites or tools would you find interesting, and then begin to turn that outside to people who are not devoting their entire life to health and begin to apply that filter that you have to then be more inspiring and more engaging and more worthy of the mind share for the vast majority of people out there. So I think take lessons from our biggest competition, the people in food, tobacco, and beverage, and how we really work to inspire people by being aspirational.
Do any of the other team members have anything they'd like to add?
This is Ed. I would say that it's a hard question for us to get, because I think everyone here gets that question a lot about benefit versus risk. And we live in a world where everyone thinks it's risky to engage patients. And so when I hear that question, I would say, on balance, there are huge benefits that we haven't even discovered yet. And so the risk is kind of a false dichotomy of, it's not whether it's beneficial or risk, it's how do we do it, because it needs to happen.
I have a little different perspective on this. As a patient and also as a healthcare provider, I think that the benefit is that the patient holds the keys to the castle. If we're going to get to good health, value in healthcare, if we're going to bend the cost curve, it requires people to take certain actions that make them responsible for their health. And until they're on the same page with their providers, they can oftentimes be working in conflict to those ends. Providers think about compliance, adherence. You know, you should be following what I tell you to do, but they don't understand necessarily what motivates their own patients. And they don't understand what patient is really a tough term, but what people are really trying to achieve in their own health. And by partnering together, we have the opportunity to really make that difference. The patient is the only one who's going to operationalize health. They, in the end, are the keeper of the castle.
That's actually a great segue to our next question, which is about adherence. Adherence, the term, is often used as another way of saying that patients don't do what they're told. How can we change the dialogue between patients and healthcare professionals so that every visit results in mutual goal setting, the true definition of adherence, or agreement on a medication, treatment plan, or lifestyle change? Amy, can I ask you to start?
Sure. Well, I think the first thing we have to start with is honesty. And that requires a person knowing exactly what their issue is, their diagnosis, and most people know that. Their prognosis, what's the likely course of their disease? Most diseases are chronic today. They may not know that. And then the different kinds of choices that they might make and what would be the benefits to them, what might be the risks, what might be the costs. Usually they don't get that kind of a deep dive discussion, so that in the end they're told what to do, and they may not understand what is the right choice for their lifestyle, what's the right choice for their pocketbook, what are their values. So for me, I focus on a palliative approach to my care. I'm trying to keep the quality of my life and not extend the quantity of my life, because aggressive treatment isn't going to make any difference for me. So I'm actually a person who's very inexpensive, even though I'm seriously ill. It's great to have these conversations to figure out at the heart what somebody really wants and support it.
Dave, could we get your input on this?
Alex, you look great.
Okay. You're fabulous.
No, you are.
You.
Dave. Can you unmute?
What?
Okay.
No, all right. I
Ted, can we get your response?
it remuted. Am I okay now?
We can hear you now.
So Peter Margolis at Cincinnati Children's had a slide that Susanna Fox shared a year ago that said 0.5 times 0.5 equals 0.25. And his point was that clinicians prescribed the standard of care about half the time. And patients do what's prescribed about half the time. So together we achieve about 25% of what we know how to do. And yet we never talk about physician compliance. When we discuss whether physicians do what they're supposed to, that's called quality of care. You know, the issue is the human thing that, and this is what I see when we discuss the role of the patient, to turn and talk about compliance or adherence is ridiculous. The issue is how can we work together to produce better results? And in particular, what I see commonly is that treatments are prescribed without necessarily asking the patient what their goals of treatment are. You know, and in that context, then it becomes a matter of not adherence, but achievement of the goals. Motivational interviewing is a technique that a lot of providers use. Like, why do you want to get better? That's my thoughts on that subject.
That's great. Thank you. Can we get your feedback?
Wait, who is that? Who'd you ask for?
For you, Ted.
For me? I agree with everything, and I think that I agree with Dave that we should really be careful when we talk about adherence, and Amy as well, because we have to look at what patients are trying to get out of things, and we should present them options and help them be partners. I think that we're not asking patients to be doctors. We're not asking doctors to be patients, but we're asking them to respect each other. And I would say think about nurses. Everyone does have a role that is respected. And so when people want to know more information, we should give it to them. And I think the challenge is that people want more information than we give them. And that results in us doing things like focusing on why they didn't do something, which is not healthy.
It would seem to me that both physicians and patients would see this as a win-win. Everything that I hear you saying is that the communication has to go both ways. Obviously, when the patient knows what's expected of them, they can agree. When the doctor knows that they've been clear in the recommendations they've made, the treatment plan gets followed and the patient hopefully gets healthy. Why do you think that that hasn't come together in our healthcare system today? Amy, can we start with you?
Yeah.
Or Ted? I'm sorry.
Go ahead, Amy.
Thanks, Ted. I think the reason it hasn't come together is a combination of things. You know, one is the basic training that we've had, which is to be able to give a definitive answer of what the next thing is that somebody should do. We're not training people to really find out what are their goals of care, what's their lifestyle, to be able to you know, discuss different options. We really have trained people in a way that says definitively tell somebody what to do next. And I think it's a generational issue. You know, the older patients today look for that, but I think that the Gen Y, the Gen X, and certainly the millennials are really going to be asking their providers to provide them with a heck of a lot more information. They're much more engaged online. They certainly are in the office.
Can I add to that, Celeste?
Please.
You know, so I'm just thinking about that, and it's like I think it's helpful to understand the perspective of a physician or a nurse or an advanced practitioner. You come into a room, it's an amazing role because you're in this room and you can ask them any question you want that you need to, and they will tell you by and large the truth. So they're ready to tell you things that they won't tell anyone else. And at the same time, your brain is just completely filling with all the possibilities of what could be going wrong with this person. It's a tremendous amount of responsibility that a lot of people willingly take on, and it can be taken on 5 times a day, 20 times a day, 30 times a day. And so I think that it's important to remember that what's happening on the other end is the desire to get it right. And so I think what we're talking about is to understand that it's okay to slow down a little bit, but it is a little counterintuitive because the number one thing, we don't want to make a wrong diagnosis. And so part of what we're learning is how to take a little more time to listen, which can be counterintuitive, but that will get you actually farther and maybe in shorter amount of time. But at the same time, there's just that overload or that overhead that people need to be aware of, because we are really concerned that when you tell us a constellation of symptoms, we're really using our brains, by and large, to figure out how those are connected. There isn't today an app that will tell you what's wrong with a person.
Celeste, can I add something quickly?
Please.
So the other thing I'd say, and you're all going to hate me for this, which is okay, because we were invited to be controversial, is we're talking about the role of the patient. And it is interesting to me how quickly in the healthcare space we bring that back to the role of the provider and the care team. And I think that is important, but I think we have to also remember that the vast majority of people's lives, as they are dealing with the reality of being healthy or unhealthy or any of the places in between, is that they live in a community with caregivers, and they go to church, and they have a job. And so not only do we have to expand our idea of who the care team is to include the greater community around us, and how do we actually influence it and be influenced by it, but we have to also remember that sometimes the biggest diseases that are impacting us are not ones that any of us have been traditionally trained to deal with. It might be that my diabetes is less important to me right now than the fact that I'm going through a divorce. And so I think we have a very traditional lens and scope that we bring to the problems that we're trying to solve, and we presume that those problems are traditional health-defined problems, and we presume that the tools that we have to bring to bear are traditional tools like the doctors and the nurses. And I love doctors, I love nurses. I took my daughter the other night she ended up getting diagnosed with croup. I ignored my doctor's opinion. I listened to my nanny and my dear friend, and then I asked the pharmacist, then I ignored the pharmacist, and in the end made a bad decision because I was listening to so many different folks, and I work in the healthcare space and I'm incredibly informed. So I think we have to remember that even those of us who are so trained to be able to get accurate information and react to it are at the end of the day human and susceptible to the vast amounts of information coming at us, and our solutions have to be sensitive to the messy reality of real people's lives. Now I've shocked all of you.
I don't hate you, Alex. I think that's just fine. Yeah. There's really no right answer. I think that our best friend, and I'm a family physician, our best friend is continuity, just being there for the person. We're not going to get it right, and neither are we. I think it's a fallacy to believe that we're going to be perfect, fallacy to believe that they're going to be perfect, and just the continuing of the relationship always makes sure that there's a way to recover.
Yeah.
Right?
And likely also being aware of all the other resources that exist.
Yes.
In terms of social networking sites, people like you, being able to listen to folks who've been through it, and tapping into those in a cohesive way, I think ultimately builds a supported infrastructure that can be with somebody over time, which is sometimes the most important thing too.
And I would say that it's important to remember that physicians are trained with the idea that they are the problem solver. At the end, in the disease state, the buck stops them in terms of the diagnosis. So they have to kind of match that with what you're saying, which is that they have an accountability and responsibility. But to do that well involves other people as well. So that's the kind of the new learning. But it's just, that's the way that we're brought up, to say there's someone there, they need your help, it's on you.
Ted, what about fear, though? As things become more complex, as illness becomes more serious, a lot of providers simply don't want to be honest. And at the end of the day, for people to be able to be actively participating in their care, they have to be honestly informed. And the system goes aggressive unless you tell it otherwise. And I think there are a lot of providers who are hesitant to have very real conversations. They say, well, it's too much for them right now. I'm going to give them a little bit of time. You're a provider. Have you been on that side?
Well, I talked about this last week with a patient, Virginia Holiday, and I talked about the fact that I was raised in a medical environment where HIV was coming up. And what I learned, this scared the medical profession, and to an extent, the medical profession ran away from it and hurt people because it didn't listen. And I saw that. And so what I realized was not to have that, it's scarier to not inform than to inform. And in the area of HIV and also cancer, and other, in Dave's case as well, there's a situation where the patients may know more about their condition than we do. And that was hit home many, many times in my training, much more than the generation before me, and I've never forgotten that. And I think that nowadays that's much more common, and luckily physicians that are training that era are going to be more sympathetic to what you're talking about.
One other thing that I would add to that quickly is Atul Gawande, who we all know and adore, is coming up with something called the physician checklist. And built into it is the assumption that there is no one answer. And what's most important is that we have an informed dialogue. And I think part of what we have to remember is people have different appetites for information, different amounts of information at different periods of time. And what's most important is to give them the opportunity to have a choice. Because there are some people for whom too much information will literally shut them down, and others who just want more and more and more and more and more. And so I think remembering at the end of the day we're all different and we're all human, patients and physicians, and developing a dialogue structure that enables people to share what will work best for them in that moment, and then give them other tools and resources for the times that come, is an important aspect of this. There's no one size fits all. There's no one hit wonder. This is going to be a process and an ongoing dialogue that we have to be engaged in.
Well, and the reason the role of the patient is a great challenge is because we're in the middle of a continuum of the evolution of what people believe. I mean, this is big-time culture change. What people believe should be done and people are capable of. I learned recently that about 50 years ago, in the early 1960s, it was common for a doctor not to tell a patient that they had cancer because there was nothing that could be done about it. And Jerome Groopman, in his book, The Anatomy of Hope, talks about his own personal odyssey as a physician over the course of his career in that area. And I also was told that, Ted, I don't know if you know any validation or correction of this, but about 100 years ago, there was a pivotal Supreme Court decision that said that a doctor was not allowed to do surgery on a patient without telling them what they were doing. The case that I heard about, a woman had her ovaries removed without her permission, and the surgeon said, I couldn't tell her because she needed them out, and if I'd told her, she would have said no. So, if you have a totally paternal doctor knows best attitude, like doing surgery on a dog, my wife's a veterinarian, that's an appropriate thing. So what we're starting to see now, Angela Coulter and others have written about the autonomous patient, the one who the care is about. So I wonder, anybody have any thoughts about that?
Yeah, just one comment, Dave, and that's that it's not so much about engaging the patient as the ability to invite them into that conversation. There are going to be some people who will decline that conversation, but I think it's a consumer right that they be included in the conversation, and at that point you can move forward. We've got to start with having people be invited into that range of discussion so that they can inform.
Well, and one of the things I love about Alex's conversation.
You make some great points. I want to try to pull from a couple of things that you said and sort of move you on to another topic. Alexandra, you said that we have to consider that a patient is more than their illness, that you have to consider their community and their psychosocial side of things. Ted, you talked about the fact that doctors are diagnostic machines, and so that's really their emphasis. How do we change the dynamic of that doctor-patient relationship so it still honors the expertise and the authority of the medical professional, but it also allows for the patient's need to be educated and empowered to be in charge of their own health? How do we move forward on this path?
Ted, go first.
Ted,
please.
Yeah, I think this is a great segue to technology, and I'll tell you why. And this is why we really want people to have access to their health information online. I practice in a health system, Kaiser Permanente, where 100% of the physicians regularly email their patients. We receive between 1 and 1.5 million secure messages from their patients. And that seems like not a big deal, but if you think about what that does, is it changes you from taking care of people that are sitting in front of you to taking care of them from wherever they are. Yeah. At work, at home, at school, at church, now with our mobile device in the grocery store. And you just learn that patients are not just people sitting in front of you in an exam room. They have lives and things to do. And so just the exposure to the people you're taking care of, and I could think to your point, Alex, about who's involved in their life. the exposure that this is a part of a community and part of something bigger than just a disease sitting in front of you, really what we have seen, what I have seen, really taps into that physician's desire to be a really, really good physician. And I think without even having to say you've done a bad job or whatever, they naturally gravitate to, oh my goodness, you know, I have to get a good diagnosis, but I also have to make this work for that person and the people around them. And so I just, that's the pitch for, that's why I've been involved in this so much, about everything in the medical record being visible to them, but also that continuous communication via mobile or the web.
Alexandra?
I just agree with that 100%. And I think the life is an evolution, and I have moments where I am very clear and I think I have the best information, and then I go out into the world and things change and people tell me things and I learn something. And I think again, what I would keep coming back to is, you know, I personally, in my experience with work, don't know how to influence physicians per se. But what we have seen in the work that we've done with consumers or humans or patients or individuals, people, whatever you want to call them, is most people are incredibly well-intentioned. They're very bright. They're working the best they can with all that they have. And their lives are just, unfortunately, very busy and very messy, and frequently do not revolve around their health. And so the more that we can bring that harsh reality into the recommendations and the solutions and the tool sets that we are putting around them, the more I think we actually have a chance to influence them so that they can ultimately be happier and healthier and more productive. And it might not necessarily be in our nature, it might not be in a double-blind placebo-controlled trial, it might not be in a care plan that exists, but what we've seen is if you give the benefit of the doubt, really help, and Amy said before, the importance of being informed. You know, individuals who are genuinely informed in words that are not condescending, that make sense to them, that they can process, who are in a community that is supporting them with people like them, they don't feel alone, they don't feel judged, will make the very best decisions. And we have technologies now that can support them in those decisions over time. I think the steps I just went through, those too frequently, we in the healthcare space forget some of them and think that people are to be lectured or be told or stupid, and I think we have to flip that frame.
Yeah, this is going to take change starting at the medical schools, you know, if not before. I mean, it may take an entire generation. I mean, how many generations have we been going through? We finally got women's suffrage, but we still don't have an equal rights amendment. We know far more blacks are executed than whites, despite all of the progress we've had in civil rights, and gay rights certainly, you know, lots of stuff going on. The thing I want to twist the question. I actually object to how the question was phrased, because the idea that the first thing we have to do is make sure the doctor's feelings aren't hurt, right? Give me a break. You know, it's not just that I think the patient's priorities, the patient's interests are first. It's a mistake to think that activating and empowering patients is an insult to doctors. I don't know any e-patients, empowered, engaged, and so on, who don't love good doctors, for heaven's sake. I mean, I was saved by teams of good doctors. You know, just so one of the things that TEDMED can do in this discussion of the role of the patient is stop thinking in terms of the first thing we got to do is make sure we don't hurt doctors' feelings. It's an error to think that patient activation is an insult to trained clinicians.
And I would say doctors have pretty thick skins. You know, we're all grown up, we're comfortable, and nurses as well, you know, seeing 10, 20, 30 people that are really hurt and need help. And so I would say this, yeah, I would say to your point, Dave, yeah, you don't need to protect us. We're here to protect you, and we're happy to help.
And I'll just say one, oh, sorry,
no,
Alexandra.
Go. Amy, go.
Oh, I was just going to say it really is a consumer protection also. So it's not just about how that healthcare team is going to feel, it's whether there's a fundamental right for the patient to be informed. I can't imagine that in any other area we don't have consumer protections. You buy a home, you're going to know whether there's asbestos before you buy it. But here, you're not given the basic information to be able to make decisions that can be much more important than buying that house.
Yeah, one of the things I'll add to this too is I think, you know, as humans, we often jump to one end or the other of the spectrum. And one of the things I think that's fascinating about this discussion is in the end, it's a dance, and it's a dance between the responsibility of all parties involved. And as much as we are asking doctors to evolve in the way that they use tools and the way they think about interacting with individuals, so too are we asking patients, consumers, people. And in the olden days, it was okay that the doctor would tell you what to do, and you would do what the doctor said, and you were not to have independent thought. So the doctor was leading the dance. And I think maybe the pendulum swung really hard, and we have a population that's like, forget what anyone tells me, I'm the only one who knows. And in the end, we should all be leveraging the very best of what we bring to the table. And different doctors have different areas of expertise, different nurses do, everybody within the care provider team. And I think this is an evolution for all of us in taking more responsibility. Nobody is going to make anybody else better. And the responsibility is also on the patient to learn and to be informed and to be an active participant in their care to the extent that they can. And the responsibility is on the providers to also recognize what are the capabilities of that individual and to be providing care that is matched to what somebody can handle. And I think all of us are moving as fast as we can to do as best as we can, but we're all in different levels in terms of how evolved we are. And that's part of it. There is no one answer. This is a big, messy, group dance that is not being done perfectly yet, and we have to give ourselves some slack as we move towards it.
I want to move you on to think a little bit about the technology that has been addressed in this discussion. We know that proactive patients are accessing information and studies about their disease and treatments oftentimes sooner than their providers. How can the healthcare system help patients differentiate between credible sources of medical information and disreputable ones? We want to encourage them to be engaged. How do we help them be better informed healthcare consumers as well?
I'll jump in first on that. The issue is actually not just patient resources, but how do we help clinicians understand which ones are reliable also? The old model that vetting through peer review was the path to reliable answers has just failed, and everyone needs to realize that. The most interesting approach I've heard these days is that there ought to be an ability to rate a resource with thumbs up and thumbs down, and I actually think there should be two tracks for that, clinicians' view of it and patients' view, because what patients find valuable may be on a different scale from what the clinicians find valuable. In the case of the treatment that I got, it's the only thing that ever cures my disease. And 3 out of 4 patients are never told about it because the information in the official databases that oncologists are told to look at is severely out of date. So there's a great book, just to shorten my remarks, there's a great book that I'm reading now called Too Big to Know, which is about how there's just too much information anymore for anyone to be on top of, and what we do in that world to assess which things are worthy of our attention. As I say, it's not just a patient issue.
Can I just add, the old question was about how do we have patients have research literacy or providers have research literacy. The new question really is about how do we crowdsource answers. And getting back to Dave's discussion, we actually will find out new things, new ways in which things are working, new side effects, impacts, by asking people who experience the disease. And I can tell you that I've gone through that as well. So we have to learn constantly from people, not just from the literature.
So to get back to the question, what's the role of the patient? One key difference today compared to 20, 30 years ago is one role of the patient is to bring useful information to the table that the doctor may not have seen.
Let me just add, like, the big heading under that is let's support curiosity. Let's allow that. That's what I've learned is that whether it's good information or bad information, the fact that a patient is looking for any information is amazing. And so what we do in our system, where we have 4 million people online with us, and we know when they come in that they're online with us, that's a sign that they're activated. And so to an extent, it doesn't matter if they're right. It matters that that's a platform for us to work with them.
I want to take a couple of questions that we're getting from social media channels. So here's the first one. In light of our changing demographics with 10,000 baby boomers aging, what kinds of considerations should we make for older patients being more activated?
It becomes even more important as people age. Oh, sorry, Ted.
It's all you, Amy. Go.
Okay. As people age, they experience going to more providers, more settings of care. Their health becomes much more complex. And as that happens, it becomes even more important that they take an active role, that they bring information from one provider to another provider, that they understand the information that they're given and they're able to relay it, because we don't have perfect health information exchange. I mean, maybe we do at Kaiser, but we don't have it for most people in this country. And so at the end of the day, this becomes even more important as we age, that people take that active role. They're the conduit.
Yeah, the only thing I'd add to that really quickly, too, is we have to remember that many of those folks who are aging into the senior population are caregivers. And in addition to supporting the patient, we have to support the caregiver. And I would just emphasize that folks who are caregiving, that's like a disease in and of itself. It's unbelievably exhausting, the burden that is placed on someone, the isolation as they're supporting a loved one. And I think one of the biggest focuses for all of us needs to be over the next 20 years, how do we do a better job supporting the folks who are caring for those of us who have health issues?
And I would just say, to add to all that, just believe that everyone can be engaged. So don't say that because someone is a certain age they can't be, which I see a lot. So just start with that idea, and like Amy's saying, listen to how engaged they want to be, but start with believe that they can be and they'll be great.
Yeah, and I would only add to that, and senior people are no longer sitting at home in a wheelchair, they're out climbing mountains, right? You better presume that they're having sex, they're loving each other, they care about being cool, particularly when they're doctors like Ted Eaton. And so don't talk to them like seniors, talk to them like humans.
Online. Another question from our audience. How can we make sure patient preferences and values are captured and taken into consideration at the point of care? Ted, can we start with you?
So I'm going to repeat the question. It says, how can we make sure patients' preferences and values are taken into account at the point of care?
Yes.
Yes? Okay. Ask what they are and listen. And so, nowadays, you can do that with online health risk appraisals, which we have. In the future, that may happen with social media because you allow your physician to see what you're doing every day and you'll understand what their preferences and values are. But it's just a really great thing to ask. We have a ton of medical information we're happy to provide, but I'd like to tailor it to what you have. And when people come to see us, by the way, when people come to see us at the Center for Total Health, the second thing I ask them is, what are you passionate about? And that guides the entire conversation. So imagine if that was the first thing that your doctor or your nurse or anyone in your life asked you. Think about how that changes the relationship for the better.
Do you have a place to write that down so other providers can see it?
Which?
What are you passionate about?
I think actually, you know what, Dave? I think actually a lot of health risk appraisals do have that. So take a look at what you've got where you are and spread the best practice.
But I have to add, I think one of the things that's really fascinating to us is oftentimes the things that define us, there's no place in the healthcare record for them to go, right? I go to a hotel, it knows that I like a down pillow in the Wall Street Journal, and in the healthcare space, it knows that I have diabetes and I'm on 4 medications and I'm on a high deductible plan, but it doesn't realize that I'm a caregiver. It doesn't realize that when I have a question, I want to go online. If I'm nervous, I want to hear from people like me. And or that I'm holistic versus conservative. If I get diagnosed with high cholesterol, I'd rather try flaxseed before I go with a statin. I think these are or that I have a dog, right? These are incredibly important variables that the healthcare space has to open up its mind to the fact that they matter and how to leverage them, and then find a place that we can store them and come back to them.
So I don't know, if traditional EMRs are going to end up adding fields for this, but it's a great opportunity for some outside innovator to develop something.
Sure they will. Sure they will. In fact, they say in medicine as a physician, take a good history. And what I learned as a family physician was, I watch sometimes visits, people don't even ask the patient what they do for a living. And so I've learned, start with stuff like that. And once you start asking questions like Alex is talking about, the things, and again, you're in a situation where people will tell you the truth no matter what you ask them. What do you do all day? How does it feel? And it's a waste to not ask those questions. And more electronic health records will capture that information because we know how valuable it is. I think the future as well is it will capture where you live and the impacts in your environment as well. So imagine the doctor of the future knowing that maybe you're not adherent to your blood pressure medicine and no one wants to die of a heart attack, but understands that you live in a place where it's hard to have a low blood pressure because of.
But the reality is that today, oh, sorry, Dave. The reality is today, at best, it's a buried note. It's a note that not everyone on the healthcare team is going to see or necessarily read. When we have the diagnosis, it's front and center. Everything is organized around that diagnosis. I think what we're talking about is the possibility of really incorporating in these changes where we can really see, as Alexandra said, we can really see the preferences and care is organized around it. And the whole team sees it, all of your providers.
I would say I'm a little more hopeful than that. I mean, I think, and again, it depends on the specialty. So I'm going to kind of cheer for family medicine. That's our training. Our training is to understand the whole milieu of the person, and I think primary care, internal medicine, pediatrics as well. And I think some of that training is washing across the other specialties also. So I think more and more it is common. I mean, not in every case, but we all know that here on this hangout. But the physicians look at that and they see the social history. There's nothing there, and they realize, I need to know more than I do.
Well, and one thing that the role of that could evolve as part of the role of the patient is maybe we teach people, be sure you tell your providers what's important to you. At the beginning of each.
I mean, tell them.
I'm going to try to get one last question in before we wrap up, and this one might take a little thought. With the implementation of the Affordable Care Act, do you think that's going to mean more or less patient empowerment, or is it too soon to tell?
I think it definitely offers opportunities. Oh.
No, go ahead. I'm sorry, Amy. Go ahead.
Oh, thanks. I think it definitely offers opportunities for more. First, under the Affordable Care Act, we have the Patient-Centered Outcomes Research Institute, which will be looking at patient-centered approaches. They've already begun funding certain efforts, but I think that's going to advance much further. Second, in a lot of the payment reforms like the accountable care organizations, the notion, or the patient-centered medical home, the notion is to be within to have a trusted relationship with the healthcare team. And in doing so, that opens up the opportunity to really build a relationship over the long term, to begin to understand goals and values, and to activate people toward their own health in more meaningful ways that improve health and reduce cost.
Yeah, I would just add to that I agree with you 100% that there's going to be more empowerment. I think there's, two additional reasons, and one is we're going to have choice. And when you have choice, people get engaged. They just, in every other industry, that's the way it goes. You start looking at things and comparing things. And the other is, now we have outcomes that are going to be measured and outcomes against which people are going to be paid. And that's going to change the perspective of the role of the patient. And people are going to work a lot harder towards that understanding of responsibility does not stop when you tell somebody what to do. Responsibility stops when we actually get the outcome that we need, and that's across the board. And when you look at the central tenets of the Affordable Care Act, that's screaming all the way across.
Oh, and it's funny because I always talk about patients being able to get what they want. This is not a matter of ditching the providers who I don't particularly like. It's, to me, the enormous opportunity. I mean, everybody on my care team, I want them to do well as we move forward in improving healthcare, and I want the ones who are working hard to do a darn good job at a good price. I want them to be rewarded and survive. And one way to do that is with consumer mobility and the interoperable medical records. The ability to take our job with us, take our case with us, and go to a great doctor is really going to help.
Did everybody get to share their perspective on that one? Okay, we're going to wrap up. I'm going to ask each of you to just take a minute and give us a closing statement. I'm going to start with Alexandra, please.
First of all, thank you. Thank you for doing this. Love all you guys. I love to hear your perspective. I always learn every time. I think the winning statement is let's support curiosity, and I would agree with that. I would also say let's support expanding the definition of health. I think health is life, and when life goes wrong, we go wrong. And until we start remembering that I am a human with relationships, I'm a caregiver, I go to a job, I've got financial stress, I'm going through a divorce, whatever it might be, These factors are incredibly important. And as we expand our definition of health to include these life factors and our coping mechanisms and to start addressing those and leveraging those, not only do we need to do that, we need to find ways to store that in the infrastructure, that is the healthcare data structure, so that the entire care team knows, the entire care team comes back, and we can finally be treating the whole person. Because it's only going to be in treating the whole person that we start to be able to march people towards being happier and healthier and more productive and take advantage of the incredible technological advances that we've had.
Amy?
Well, I also want to say special thanks to TEDMED. I heart TEDMED, and thank you also to RWJ for supporting the great challenges. Healthcare used to be go to a physician, get cured. It's a chronic disease world. Everything has changed. It's older adults with chronic disease. This is the bulk of the care issue, the cost issue. And so in the end, if we aren't engaging people in how they handle their lifestyle, if we're not engaging caregivers, really everything that we've talked about today, if we really aren't thinking about the community, we're not going to be effective in being able to meet the great challenges. At the end of the day, the person experiencing the illness is going to have to make change, and they're going to have to be working in partnership with that entire healthcare team, not just medical model, but also all of the supports and services in the community. We've all read Atul Gawande's Hotspotting. It is important that the person is engaged and their family is engaged.
Thank you. Dave?
I'll just be very short. The best way, as I said in my TEDx talk, the best way to a sort of a true north that we can pursue in improving healthcare is to just let patients help. Let patients define what's important. Let patients help do the work in every way. So just everyone have a great life, and be sure you get plenty of vitamin E.
Ted, please.
I think I would say that I believe this is the decade of the patient. And if I'm looking at who else is on the Hangout with me, and also I'm thinking about Regina Holiday, I think one of the coolest things I never dreamed that would happen is that patients actually care and take time to push us as doctors out of our comfort zones, but because they really do want us to be well. And if I were to think back 15 years and believe that there would be a group of patients that wanted me to be a better doctor and would fight for that, I think that's a huge, huge gift. And I think we're, the medical community, nursing community, is so lucky to have that. And like Dave is saying, let's take advantage. It's pretty awesome.
Thank you all. We covered a lot of ground in a short period of time. There were a couple of themes that came out that I think bear repeating. One, which I think is incredibly important, is that the patient holds the key. They need to be responsible. They need to push providers. We need to make sure that both parties ask and listen, that they're honest, that we work together to get better results, that we use technology to the fullest, and that we remember that adherence equals achievement. And it's not doing what you're told, it's doing what you've agreed and understand to be important. We want to thank our challenge team from today, and also acknowledge that unfortunately Rebecca Burkholder and Teresa Brown tried to join us and had technical difficulties, and we missed having their input as well. Thank you to all the team members who provided their time and thoughts today, and to the members of the TEDMED community who logged in to take part and who provided comments and questions. If we didn't get to your question, remember the dialogue is always open at TEDMED.com, on the Great Challenge pages, at the role of the patient, and also on our Facebook pages. We'll have the opportunity to discuss this and other topics in the next live event, and keep an eye out for future Google and Hangout notices. Finally, we want to thank Robert Wood Johnson Foundation, sponsor of the Great Challenges. Thank you all for your participation today. Have a great day. Bye.